so we will go ahead and begin the pre-meeting here. And so I will call the pre-meeting to order. And we have Councilman Graham will be giving the prayer.
Yes.
And being pro tem, if I lose the connection and have to get back on, he'll be taking over in that moment if that happens. And under item 4, miscellaneous agenda items, I would like to add a pandemic update. That's kind of been our standing update we've had the last couple of meetings. I forgot to add that on to the agenda. So I will ask when we adopt the agenda to amend the agenda with a pandemic update. And we have no public hearings. We have a few appointments here. Would that be Gail? Probably. Moving on to presentations from staff, consultants, and invited guests. We have Ross joining us from the Rock Island Trail to give a brief announcement about that and presentation. And then number 9, I'm happy to report we do have a new Lincoln University student representative update that was just selected. So I don't think he'll be on tonight's meeting, but probably here in the future. So I may have Carlos just give us a little bit about him. His name's Stacy Landis. Consent agenda, any questions there? Bills introduced, we have number 45, Ryan.
This is the ordinance that establishes the election date for the upcoming April general municipal election. This is our standard ordinance that we do every year.
Any questions? Okay, and number 46, Matt.
Yes, let's just vacate a portion of old street right away off Beath Drive by the water company there, Water District 2. And they own property on both sides of the road, and they're wanting to utilize the whole property to construct a new building on. So this would vacate that old right of way.
Any questions? Okay, and bills pending, number 42, Matt.
A construction contract with SGI. It's a HVAC type contractor, and they'd be replacing our HVAC, heating, cooling, ventilation out of the wastewater collection building at Hyde Park. Original to the building. Contract amount is $50,905, and we did call their references and recommend approval.
Thank you. Any questions? And number 43, Sunny.
Thank you. This is basically a replat of the Capitol Mall plat where the property owners are wishing to more or less cut out the old Sears building to a 0 lot line parcel. That is so that they could make it more developable or as an opportunity for either selling or leasing that in addition to what they're currently doing now with it. It is also a subdivision approval regarding the street frontage. It's gone to the Board of Adjustment for a zoning variance, but the subdivision code requires street frontage, and there are agreements in place with the property owner to allow infrastructure and street access and parking and things like that. That's an agreement that's been in place already with the other tenants of Capitol Mall. With that, I'd be glad to answer any questions.
Any questions? Thank you, Sunny. Nothing on the informal. We have resolution 20, Sunny.
Yes, we are applying for a grant that would hire a consultant to help us put together a National Register application for the area out off West Main, Wallenco and General Realty subdivisions, which last year we used grant money to actually do the architectural survey on those properties. If we did get the grant, it's a 60-40 match. We anticipate the grant award would be $9,000, and we would need to match that with $6,000. We do believe this will probably not be awarded till August, so this may not actually be anything that is done in fiscal year 21, but actually fiscal 22. So we do have time to allow for this in our budget, and if it does come really early, we can ask for a supplemental appropriation at that time. Be glad to answer any questions.
Any questions? All right, thank you. And that's basically wraps up the meeting. Since we still have a few minutes, I'm going to go back to the pandemic update under item 4. And we will have Christy Campbell from the Cole County Health Department joining us. So she has asked if she could go really early in the meeting because she has another obligation this evening. So we want to make sure and kind of have her present and then ask her any questions, and we'll let her leave the meeting. After that, she's going to go over the new guidelines for contact tracing. So we'll have that update. And then after Christy, we will have Dr. Lenora Adams from SSM Health. She'll be joining us also to give us their perspective on the pandemic, and she can stay with us longer. So if we have any discussion with Dr. Adams, we can keep her on as we move through that. After Dr. Adams speaks, I will have the advisory, the city and county advisory that was submitted on November 12th. And we did the press conference on Thursday and read through that. So I will go ahead and read through this one-page advisory. You all have it in your email already, and it's already been put out, but I will certainly go through every point again in that advisory and read through that, and then we can have some discussion after that. But I wanted to give you kind of the rundown of that update since we have a few minutes. Any questions here before we adjourn and get ready for the real meeting? Okay, with that, I will adjourn the pre-meeting, and we have, let's see, 5:53, so time to take a little break, and then we will begin at 6. So just everybody hang tight and do what you need to do, and we'll be back here again shortly. Thank you.
Madam Mayor,
Councilman Graham.
when I get ready to pray, I will stand. So if I stop videos, because I want to stand directly in front of the camera. So, but whenever I pray, I stand. So FYI.
Okay, thank you, Councilman Graham. And I tend to stand too, and even standing for the pledge. So, which reminds me, I will go grab my portable flag for the pledge. So I will be right back while I do that. So thank you all. Emily, are you on there? Is it easy for you to text me the link to this meeting so I can send it to Lenora, to Dr. Adams?
I can go email it to you from my computer.
Okay, and then I'll copy and paste it into a text. Thank you.
Okay.
Thank you, Emily. And I was just thinking too, I could have copied it here from the, what do you call it? Calendar invite.
Oh,
See, I didn't think about that. And hi, Christy. And I also mentioned after you're done, do you want to that testing event in December that you sent out?
I can say it's the week of December.
I'll leave that up to you. For some reason on my end, you were kind of coming in and out, but was that only me? Could you all hear Christy?
No, no,
it was
doing
cutting.
it here.
No. Okay. Christy's kind of frozen on my end. So Christy, should I give you our call-in number just in case?
Sure, I'm at home with sketchy internet. So actually, I have the call-in number. I have it pulled up on my.
Okay. I think so, just because I'm kind of getting
Would you rather
every other word.
Would it be better?
Probably because it looks like you have a little spinning circle on your thing and I can get a, yeah, go ahead and call in.
Okay, will do.
Perfect. Thanks, Christy. Okay, so I think what I'll do, it's just now 6 o'clock, so we will get ready to call the order here. So welcome, everybody. Before we begin the meeting, we will have a prayer from Councilman Graham, followed by the Pledge of Allegiance.
Good evening, all. If you could, please stand with me as I lead us in prayer. God, we give you glory. We give you praise. We give you honor. We magnify you. We lift up your name. We celebrate you. We humble ourselves before you. Angels bow before you. Heaven and earth, they adore you. We acknowledge that there is but one name by which the world can be saved, and that is in your name, Jesus the Christ. Thank you, dear Lord, for all that you are and being the great I am. We bear witness that you are the only God. You are the truth, the life. You are the only way. God, we are grateful that while we were yet sinners, you died for all of us. When you hung on that cross to save this world, you did not have in mind to die for just a certain group of people based on political affiliation or color of our skin. I am in amazement that 1,000 may fall at your right hand. We can call on you as the mighty one, the rose of Sharon, the lily of the valley, the wheel in the middle of a wheel. We give you praise this evening simply because of who you are, not because of anything that we have done. God, we adore you. We are grateful just to be able to speak your name out loud. Kings and kingdoms may all pass away, but there is something about the name Jesus. Jesus, we call you in the morning. Jesus, we call you in the noonday. Jesus, we call you in the late midnight hour, when we know that you are about to turn it all around. Lord, right now, even on this virtual meeting, I'm trying to ring the bells and sound the alarms to get your attention. God, we need you on this earth right now. Now, God, I pray for the thousands upon thousands who are in hospitals right now, who are in nursing homes, who are in hospice, and are unsure about their future. I pray to you right now that you will see about them. I pray for those who stand on the other sides of plexiglass. I pray for those who are in danger, who are in prisons and jails. I pray for those who are dealing with food insecurities. Blessed be the rock of our salvation. God, you've been too good. You've been so good to us. God, we don't even deserve it. I'm appreciative. Thank you, God. Thank you that you didn't allow us to die last night, but you allowed us to live another day to get it right. I thank you, Lord, that those of us on this call tonight are not on ventilators or respirators. Thank you that we are not in the ICU. Thank you, dear Lord, that we are not sweating in the middle of our bed. Now, Lord, touch my colleague, Mark Shriver, whose mother you called home last week. Let him be encouraged that you allowed her to pass this way for 96 wonderful years. Bless our servicemen and women, both home and abroad. Protect our public service team members. Be with them from the start of their shift to return of their homes. Bless this world, bless our nation, bless our state. And I ask a special blessing on our beautiful city of Jefferson. In Jesus' name we pray. Amen.
Amen. I pledge allegiance to the flag
of the
of the
United
United States of America, to the republic for which it stands, one nation, under God, indivisible, with
liberty
and justice for all.
Born and unborn.
Welcome, everyone. I will now call to order the Monday, November 16th, 2020 City Council meeting. Due to the COVID-19 social distancing recommendations, the City Council is meeting by virtual only. You can view this meeting on City of Jefferson Facebook page. You can join virtually with a link on our agenda, which can be found at jeffersoncitymo.gov, or you can call into the meeting at 404-397-1516. The meeting number is 146-878-8472, and the meeting password is 1234. Mrs. Donaldson, roll call, please.
Fitzwater,
Present.
Graham,
Here.
Hensley,
Present.
Hussey,
Here.
Kimna,
Here.
Lester,
Here.
Schreiber,
Present.
Vogt,
Here.
Ward, here, Wiseman,
Present.
Item 3, I will entertain a motion for adoption of the agenda by adding the pandemic update under item 4 miscellaneous agenda items. Is there a motion to approve?
So moved.
Second.
Any further discussion? All in favor say aye.
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 Any opposed? Motion passes. So we will start with a pandemic update, and we have with us on the line Director of the Cole County Health Department, Christy Campbell, and we also have Dr. Lenora Adams. We're going to start though with Christy Campbell to give us an update on the Cole County Health Department. Welcome, Christy.
Thank you. Good evening, everyone. I'm sorry I was not able to join virtually, but I hope that everyone can hear me okay on the phone.
Yes.
Okay, great. Well, I wanted to give you a little update. I'm sure if you have been following any of the national state news, you will see that despite several restrictions and public health interventions, cases of COVID-19 are on the rise pretty much everywhere. Everyone has been tracking the hospital situation. I know that Dr. Adams will speak about that. But for us at the Cole County Health Department, we were really learning with our contact tracing efforts that there's so many barriers to it, and we felt like it wasn't the most efficient use of our time, and we weren't getting notices to the people in a timely manner. So last week we implemented a new contact tracing strategy, trying to get the information in the hands of the positive cases as quickly as possible so they can notify their contacts as quickly as possible. There was just too many gaps in the system, and we wanted to try to make it more efficient and to be more effective. So we did implement that last week. Now when someone is tested for COVID-19 at the testing site, they're given information that they can start that contact tracing process on their own. We'll still be working with businesses, and we sent out something to the Chamber of Commerce today so they can circulate it to businesses. So if they call and say, you know, we've had an employee who tested positive, you know, walk me through the process, we can do that. And we still have our contact tracers on board that we can help, that can help businesses, and we're still deploying them into the schools. You might have also seen that the governor released some new school guidance last week about the wearing of masks. There are several health departments in the state that are not adopting that guidance. We maintain that every situation needs to be evaluated individually. You know, there might be a situation where kids are sitting very close to one another and they're both wearing masks, but if one is coughing and sneezing, we know that that mask is not going to be 100% effective in stopping the transmission. So that other child will still need to be considered a contact. So I know it's very confusing for some people, but every situation really needs to be evaluated differently because they're all different. We're also updating our website with a lot of educational information, and we're updating our website with tracking and the number of cases. We want to remind everybody about the exposure risk with the upcoming holidays. You know, as Dr. Williams said last week on the press conference with the governor, you know, you're most likely not getting that virus at the grocery store. You're getting it in those small gatherings where people are not social distancing, where they're eating, they're drinking, they're being in very close contact with those you love. You're probably going to get it from your friends and your family. So we want everyone to reduce the number of people that they are spending that close contact with, you know, and really have everyone think about, you know, if you tested positive tomorrow and you had to name everyone that you've been within 6 feet for more than 15 minutes of in the previous 48 hours, how many people would that be? You know, when we started the contact tracing in the beginning in March and April, people, you know, were staying home, so it would be 2 or 3 people. Now people are going about their business and it might be 20 or 30, and that's a problem. You know, we need people to reduce the amount of interactions they're having with others in that close contact and really, unfortunately, stay to themselves. So, you know, last week we did do that advisory, and I'm really appreciative of the city's support where we're trying to advise everyone to take those actions themselves to protect themselves and to protect others. So if anybody has any questions for me, I'd be happy, or if there's anything else you'd like me to add. I will add that we did have a testing event last week at the First Assembly of God on Route C, and that was conducted by the Missouri Department of Health and Senior Services and the National Guard. They tested 505 people, and I think there was around 84 positives, but I don't know if all of them were Cole County. And now they will be doing another testing event here at the same church the week of December. I don't have the exact date, but we'll be sure to publicize that once we have it. And that is free testing for anyone that is a Missouri resident. And they even have the self-administered swabs there where the National Guard helps you administer the nasal swab yourself if you don't want the oral pharyngeal swab. So
Thank you.
I'd be happy.
I do have a couple of questions. One, I was asked about cases and numbers on the website, and you had mentioned you're updating the website with case numbers, but it's slightly changed a little bit. You went over that briefly, but could you mention what that change is and what the cases are, what you are having on the website?
Sure, because we won't be able to speak to every single person. We won't know their onset date or their, and they become non-active after they're 10 days past their onset of symptoms or their test date. So we'll just have a total number of cases on our website, and then we'll have the cases per day. And we're also considering changing from posting them on the day we learn about them to the day that they actually get tested, because we feel like that's a more accurate representation of what is happening on that day. Because if we, like right now, we report the number of cases that were reported to us today, but that could be a collection of, 5 or 10 days of testing because of the lag time. So we're trying to find a way to accurately report that data in a way that is easy for everyone to understand. And unfortunately, it's a struggle, and the lag time in receiving that data is not helping us confront that challenge.
Okay, I also have a question on the contact goal and why this new method was implemented with the lime green sheet that has the spreadsheet of exactly what people should do that's handed to them as soon as they get tested. That the reason, as you touched on, was for efficiency, and time is really imperative that these results are distributed among contact tracing among people they've been with in a very quick manner, rather than waiting to get that information to you and then you follow up with the person and then they give you the contacts and then you try to reach out to them. There's a little bit of overlap and inefficiencies there. Originally, I had asked you, though, my concern about is it reliable if people are currently tasked with letting you know, the health department, who they've been contacted or who they've been in contact with. How would we know that they would do that on their own? And I know that you voiced a few concerns that I wasn't even aware of that you have faced with people telling you. Do you want to give us a brief overview of the reliability of contact tracing?
Sure. So we know that some people don't even want to get tested because they think that they'll be added to some list and their name will be taken down by the government and that we'll be tracking them. And then others, once they get tested, they don't want to tell us who they have been in contact with, or a lot of times people have already told them because it's been 3 or 4 days. And some people are going to be more likely to tell their contacts on their own than to tell some stranger over the phone. Chesney had a situation the other day where she talked to a person and they talked about their spouse's exposure and positive tests. They talked about their kids' positive tests. They talked about symptoms. They talked about the whole household. Perfect. All done. 2 days later, we get a call from a school that says, hey, we have a child here that's talking about mom and dad and siblings that are positive. Chesney looked into it. Well, sure enough, the parent neglected to tell us that they had 2 kids that were going to school. So we know it's happening. We know people aren't telling us the truth. We know they're withholding information. So unfortunately, through all of this, we have to rely on people to do the right thing, to tell us the truth, to take the right actions. And that's the best we can do. We're not omnipotent. We don't know who's everybody's been with. We don't know if you have kids or not, and we need you to be honest. So our hope is that people will be more willing to tell their friends than to tell us over the phone.
Thank you, Christy. And that lime green sheet is available on the Cole County Health Department website. it to the city's website as well. I've shared it on social media. I think it's important for everybody to look at that and really take to heart what you said, Christy, is if anyone had to contact trace, what would your list look like? And we need to do everything in our power to keep that list as small as possible. There's no reason that list should be long for anyone. So we appreciate your time on that. I'll turn it over to council. Any questions for Christy before she has to leave the meeting? Okay, I don't see any. So Christy, thank you. I know you have another obligation, so we will let you go, and appreciate the health department's working with us, and we will continue that communication. We will be also having, although we meet regularly, we will be having a press conference on Thursday, so that time will be announced here shortly as well. So we will continue to get that word out. Thank you, Christy.
Oh, and thank you to the council. I really appreciate your help and your advice. And I would like any of you to reach out to me at any time if you have any questions or comments, and reach out to the commission and copy me, and we'll be happy to get back to you. Thank you.
Thank you. And now we have with us the Regional Vice President of Medical Affairs for SSM Mid-Missouri Region, Dr. Lenora Adams. Welcome, Dr. Adams.
Thank you. It's good to be here. Wanted to provide an update about what's going on with the hospitals in town. We started out our day today with 34 COVID positive or presumptive positive patients, and that number did go up throughout the day. I just spoke with Dr. Haight at Capital Regional. They started out the day with 41 COVID positives and exceeded their capacity on their COVID unit, so their floor, and had to overflow COVID patients onto another floor, starting at one end and trying to fill up that end before filling up the rest of the floor. So also this afternoon, we have frequent incident command updates due to our limited capacity for patients. And within a period of 1 hour, we had a surge that put us over our capacity in the ICU. So our ICU is now over capacity, and we're having to shift around our resources to care for those patients. But so I think that just goes to show that things can change very rapidly with this pandemic. You can start out the day thinking that things are going to be fine and we have enough resources to take care of the patients that are coming in, and within a period of an hour that can change, as it did for us today. Also today we were notified by the Mississippi River Valley. Let me find it here. The Mississippi Valley Regional Blood Center, which provides all of the blood and plasma to the Midwest region, that they are depleted of their COVID convalescent plasma. Of course, they have people that continue to donate, but they'll only have 1 or 2 units available here and there. So there is, I guess this is a national problem, but the supplier for our area is depleted at this point. So things are stressful, unprecedented times, unprecedented stresses on the hospitals, on the nursing staff. We have nurses who essentially are exhibiting signs of PTSD. So we've brought in psychiatrists to work with them and counsel them and try to help them through this very tough time. It's very strained. I agree with the recommendations that Christy gave earlier on masking and social distancing, particularly through the holidays. I think it's going to be a hard shift for people to imagine holidays in a different way, but this has been a year of change, and we've all learned to live in different ways. And I think this year is a great opportunity to explore new traditions, maybe virtual traditions, really minimizing the amount of contact that we have with people, especially in close proximity, closer than 6 feet away. Does anybody have any questions?
Thank you, Dr. Adams. Are there any questions?
Yes, thank you. Thank you very much, Dr. Adams. I just have a couple of questions. But first, I'll say that the description that you just provided about conditions in your facility and elsewhere at other facilities is jarring and of course very troubling, but also consistent with what we're hearing about other facilities around the country and places around the world. One thing just to ask about, when you say that COVID floors or COVID units are at capacity or overflowing, is it both a problem of available beds and other equipment, or is the issue available staff to care for patients, or is it both?
This is an issue I really want to highlight. So thank you for asking. Just because the hospital has so many beds does not mean that we have the capacity to care for patients in every one of those beds. That's the rate limiting factor. So right now, last week we had, I think, 34 nurses and staff who were out because of COVID, because they themselves had it or were on quarantine because of very high risk exposure. So that decreases our nursing pool substantially. And when we don't have nurses, then there's no one to take care of the patients. So our capacity is very much so limited by personnel, nurses in particular. We have, in our hospital, we have reached out to agencies, and we have 5 more nurses starting on Monday and 5 more the Monday after that. But across the country, nurses are in very, very high demand, and agency nurses are few and far between. So yes, your suspicion is correct. We're not limited by the number of actual physical beds. We're limited by our nursing resources.
Thank you. And can you repeat how many of your staff are out there have been recently?
I think today it was 24 we had out, but it was as high as 34 last week. And that includes the medical group as well, so the ambulatory clinics, not just the hospital.
Okay. Thank you. My other question is, I know you said just a moment ago that you're supportive of the advisory suggestions. Are there other more concrete steps that you or your hospital group or that doctors when you collaborate or speak, which local leaders were taking to pitch in and try to help you all out?
Sure. So we are in communication with the hospitals. Myself and the other CMOs of the other hospitals are all talking to each other on a pretty much a daily basis, keeping each other updated on what their hospital's capacity is and the trends that they're seeing in COVID admissions, so that we know what the capacity is across our region. So including MU, Boone, we have regular conversations with all those people so that we know what the resources are. So like today, for example, when we exceeded our ICU capacity, we did decide to cancel, or we will eventually reschedule, of course, but for tomorrow we have canceled elective surgeries that require an admission afterwards. So some elective surgeries, you don't have to be admitted to the hospital, and those are continuing. But if it's an elective surgery that requires that you stay in a hospital bed overnight, obviously we've exceeded our capacity to be able to do that for tonight and tomorrow. So we've canceled a handful of surgeries that fit into that category. When we do things like that, we do look to our neighboring hospitals to see if they have capacity to take surgeries that require admissions. So for example, we have, if like an open heart surgery, if we don't have any ICU beds left, we're reaching out to Capital Regional asking them if they have ICU beds available if someone needed to have an open heart surgery, as an example. Is that what you meant?
No, I was wondering if there are other interventions or actions that local or regional officials should be taking in order to help out.
Well,
please mute. We have some background noise, so not speaking, please mute.
Yeah, I'm
And
sure the hammering is not coming from my end, but I can never be sure.
I think it's the chef in my kitchen. If you want to hold on a second.
oh, that's okay.
All right.
All right. You know, we have ventilator capacity. If we need to get more ventilators, we know how to do that. We've been working with the Missouri Hospital Association to improve communication across our region from many aspects. I can give you some examples. Post-acute care beds. So after you've been in a hospital, if you continue to need some kind of care, but you don't need to be in the hospital anymore, you might move into a post-acute care bed, like a nursing home or a SNF or a long-term care hospital, that kind of thing. We are in the process of trying to streamline the data that tells us how many of those beds are available, because as you may have heard, on occasion, nursing homes are closing themselves to admission because they have a COVID outbreak, so they're not accepting patients for a certain period of time while they get their infection prevention under control. And it actually takes a lot of manpower to call around to all of the nursing homes and SNFs in the region to try to figure out who has beds and who doesn't, and that kind of thing. So as a region, we're trying to put together an electronic survey that these post-acute facilities can fill out on a daily basis and send to all the hospitals at once. So it will decrease calls for them, decrease calls for us, so that we know what our post-acute availability is. That's important because we do need the patients, if it's appropriate for them to discharge from the hospital because they no longer require that level of care. It's important that they're able to do that because that frees up beds for people who are coming in who need that hospital level of care right now. So it's about the throughput through the whole hospital from the front to the end of the admission.
Okay, thank you. And my final question, aside from equipment needs within the hospitals, do you perceive to be the consensus among the medical community in this area that suggestions regarding behaviors such as distancing and group size and masks is sufficient to help stem the tide of what's coming into your facilities?
Are you trying to get at advisory versus mandatory?
Yeah.
Okay. I think it's impossible to enforce a mandatory rule. I'm sure there's some ways that we can influence people's behavior in a way that's compelling, that makes them want to change their behavior. And I'm not an expert on that, but that would be the way that I would go about it. I know there are people in the community who would like to see mask mandates and enforcement, but I don't know that that's really striking the right note. When this is a really we are all in it together thing, maybe we need to be more compelling in our delivery. I think that would be more effective. That's my opinion, actually.
Do you have recommendations on what might be a more compelling delivery?
I would stories of other people who have had bad outcomes from having COVID. I think that's very compelling when you hear of someone who has had something very unfortunate happen to them.
All right. Doctor, thank you so much for running your update tonight and responses to my questions, and of course for everything that you and colleagues are doing and dealing with right now. Thank you very much.
Thank you. We could use your prayers right now. Over the weekend, things were pretty stable, but today we did see a sudden, unexpected surge.
Dr. Adams, I also your stories that you have told us this evening of the situation are very compelling, and this meeting, of course, is being recorded so it can be shared, and I think it's really important that people take this information and that this will compel them to do what they need to do. And stay with us for a moment. We're still going to continue this pandemic discussion, so Afterwards, if any further questions for you. I just ask, I hear a little bit of echo, so maybe just mute there. But I do want to share the advisory that we put out on November 12th. And this is a city and county advice. And it is very clear and concise, so I'm going to read this. It says, call to action, we need your help. With the number of COVID-19 cases on the rise, we need your help to slow the spread of the virus. Cole County and Jefferson City are advising every person in Cole County to stay home if you're sick, physical distance from others outside your household, limit gatherings to a number that physical distancing can occur, avoid gatherings where physical distancing cannot be maintained, wear a mask if you cannot physical distance and avoid gatherings, encourage telecommuting and physical distancing within office buildings. Offer low contact shopping methods, including curbside and delivery, and increase distance between seating and restaurants. Together we can slow the spread, but we need everyone to do their part. Protect yourself, your family, and others by following these guidelines. We are asking for your help. Please do your part. Mayor Turd says, please reconsider any plans that include gatherings. We ask these recommendations be followed because we care about the health of our community. We want our businesses to stay open, and we work closely with our local hospitals and physicians in offering this guidance. Cole County Presiding Commissioner Sam Bushman says, more than ever, we need to be careful. Socially distance, wash your hands, and if you're sick, stay home. Wear a medical grade mask if you can't socially distance. And if you don't feel comfortable at a meeting or gathering, leave. Use common sense and be safe. This is not a mandate and does not include enforcement by the Cole County or City of Jefferson. It is an advisory. Please do not call the Cole County Health Department with concerns about enforcement. This has more information. For more information, please visit the CDC website at cdc.gov, Missouri Department of Health and Senior Services at health.mo.gov, and the Cole County Health Department website at colehealth.org. So that is stated very, very clearly, this directive that we're asking every single person in Cole County and in Jefferson City to do and to follow. It's on the website, it's been shared. I need everybody's help in the community to take this information along with what Dr. Adams said, and please share it. Does council have any questions on the advisory? Councilman Hensley.
Yes, thank you, Mayor. I don't have so much a question as much as a comment, and then I do have a motion to make. First, I want to thank you for your leadership on this. You've been tireless in working on this issue for what feels like the past 40 or 50 years, but has really only been the last 7 or 8 months. I think it's important for the city elected leadership to all speak with one voice on this, and I appreciate you signing off on that. But I would like to make a motion that the city council officially endorse the city county COVID-19 advisory of November 12th, 2020, as you just read, and I'll make that motion now.
Thank you, Councilman Hensley. We have a motion. Is there a second?
Second.
I'll second that.
Several seconds there, and thank you for that support. Any further discussion on the motion to endorse? All in favor say aye.
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 Any opposed? That was unanimous support, and thank you. And although I feel like there's nothing more important than this advice, what we do need is all of our community members to share it, every council member to take this and get it into your wards through mailing lists, through social media, through texting, through your friends, through your family. Any group that you're associated with, please share this every chance you get. I commend City Council for meeting virtually. We've done this now in November. We're going to do it again in December. We need to be that example. Today I had somebody who wanted a mask mandate and is part of a group that is meeting in person. So we had that discussion, like masks are very important. This advisory outlines everything, including masks, but it also says, please, for meetings and groups, think about telecommuting, think about distancing and going virtual if you can. We've been that example, and we invite and encourage everyone to do the same. It is very important. Once again, Dr. Adams, thank you for being part of this call on the meeting here tonight. Are there any more questions for Dr. Adams this evening? And I know, like Dr. Adams said, I mean, we are getting close to Thanksgiving, and you mentioned maybe some creative ideas. This is the time to do that. So I know, I think it was a pretty clear message. You made it pretty clear that we need to rethink our Thanksgiving and our gatherings.
That is true. I actually have a question for the council. And I think that the Cole County Health Department and the other healthcare leaders in the area would like to know what kind of gaps you see in education surrounding COVID amongst your constituents. So if you're out and you notice misconceptions or inadequate information, people trying their best, but not meeting up to the standard because it's a lack of information, those are areas we would like to know so that we can intervene, because I think we have to put the power of this into the hands of the citizens. It's their responsibility to do everything they can to help from spreading it to other people. But we need to make sure they know what those steps are, and that the information they have is accurate and complete. So if you could feed that back to the Cole County Health Department and whatever group you think is appropriate, Carrie.
I appreciate that. I'll open it up to by saying one that was brought to our attention today was masking guidelines for proper mask wearing, that some people may not be aware as far as the hygiene and cleaning and that sort of thing. So we think that's really important. And I know on Thursday we will talk about that at the press conference. Also, just with Thanksgiving coming up, some holidays specific to Thanksgiving advice that people seem to think they've been apart from their families for so long that they think it's very important to travel or get together, and that is really not the best idea. But if they are, to think of some spacing and virtual methods. Anything else that you all are hearing in your wards or seeing? Any council members? Any gaps?
Go ahead, Mike.
Councilman West.
Yeah, I was just going to say, I think some members of the community think that herd immunity is a viable strategy, and I think anything that can be done to dispel that belief would be important. My understanding is that no virus like this has been ever controlled without a vaccination through herd immunity.
Well, and also regarding herd immunity, an MU researcher last week, it was announced, discovered that this virus has mutated 3 times already. So it's changing. So even if you get it, chances are you're going to get it again if you continue to not social distance and wear a mask and wash your hands.
Yeah, I would just add what Laura added was, I ran into somebody 2 months ago at Sam's Club who had it earlier. And so she was like, well, I'm wearing a mask, but I really don't need to, I guess. And so I think there's sometimes some misconceptions about it. Once you've had it, do you still need to take proper precautions, and what exactly should you be doing? And secondly, I think there's been a lot of education. Nobody is ignorant that COVID exists and everybody understands it's here. I think it's just an acceptance of that this is a common strategy that a community has to go through to battle this. And I think that a lot of folks everybody probably knows somebody who got it and didn't really have any symptoms and got through it. And so that becomes the norm in their mind. And maybe the extreme examples are not as well known to folks, or they hasn't personally touched them in that way. And so it's just, well, if I get it, I'll be down for a few days and I can battle through it, and that'll be okay. And I think that the compelling story now for me is what you started off with, Dr. Adams, which was the hospital overcapacity on ICU and the floors, and what specifically that means for somebody if they needed to seek emergency medical care tonight in this community. Like, to me, that's what starts to move folks. I hope, at least.
Yeah, I'll jump in and build a little bit on what Ken just said. You hear a lot of folks who seem to think that death resulting from this is the only meaningful metric, and that it's either you are, whatever the statistic, they throw out 99.9 something percent of people survive it, whereas there is a much larger population of people who get it, who are having a wide, a much broader experience with much different health challenges as a result of this that may not result in death, but are resulting in a great deal of discomfort and pain for a much longer period of time. So, it's not simply either you'll be among the many who survive it or you'll be dead. It's odds are decent that you'll survive it, but be aware that there's a whole menu of other very dangerous and uncomfortable conditions that could go along with it. I don't think I just said that very well, but just broaden the threat field a little bit. And Mike's point about herd immunity, you hear that a lot, and then about we're still hearing about the dangers of wearing masks. So hypoxia and germ retention and stuff like that. So there's a lot of that still out there, and some of this is we've all been hearing the same stuff for the past many months. So is one more touch of education going to do it for folks or not? But those are the areas that I'm hearing the most when I talk to folks.
And I would just add, like, the asymptomatic spread. I think in talking to folks, it's almost like that's a little bit forgotten, that you can be asymptomatic, not even test, and still be spreading this. And I would encourage people to go to that free testing that Christy mentioned as well, and that Carrie highlighted, and take advantage of that. So you never know if you're positive.
Concerns, and if we think of any more, Dr. Adams, we will get them to you, because it's important that we get this information out, because this is very important. This is urgent, and I plead with all of you in the community to do what we need to do. And you can take the word advisory and you can insert whatever word you want, but I'm going to tell you what this advisory means. I would substitute the word urgent on here, and this means do it. And if you're getting caught up in that word, then you're missing the point. The point is very clear. Stay home if you're sick, physical distance, avoid gatherings, wear a mask, telecommute or teleconference if you can, and have low contact when you're out. Don't know how else to say it. We can say it in many other words, but this advisory is urgent. Thank you, Council, for endorsing this. And we need every household in Jefferson City to do the same and endorse this within your own household, within your place of work, within your business. If you're still meeting in person, you have some work to do and get these things shifted around, because it's going to take a shift of every single one of our habits and behaviors to get a handle on this. Dr. Adams, your comments were very compelling. And like I said, this is recorded. I would encourage everyone to go back and listen to what Dr. Adams had to say during her presentation. So with that, we will let Dr. Adams go on for the rest of her evening. Thank you for taking the time. We appreciate it very much, and we'll do our part and all that we can to keep our community to slowing the spread. So thank you, Dr. Adams. All right. Now we will go on to item 5, public hearings. We have one this evening. Item 6, appointments by the mayor, Mrs. Strope.
Thank you, Mayor. Our first appointment is to the Housing Authority Board, and that is Mary Simmons. And then we have 3 appointments to the Planning and Zoning Commission. That's Doug Record, Greg Butler, and Spencer Hogeveld.
Do we have a motion to approve that slate?
So moved.
Second.
Any further discussion? All in favor say aye.
Aye.
Any opposed? Motion passes. We appreciate our volunteers and boards and commissions. And, you know, I forgot to say something in that COVID discussion. I'm going to backtrack here really quick. And I know we spent a lot of time on it, but something that was brought to my attention, and I think it's an interesting analogy that what the council is doing is it's almost like we have sounded the warning siren. And I think in our community, we're well aware of what that tornado warning siren is like. And we've sounded the siren, and as council members, we can fund a siren, we can put up a siren, we can send that signal out, we can get that siren out. But what we can't do is get in everybody's house and make sure they're getting down in their basement. And we know there's some that aren't even going to get in the basement. They're going to get out and look around and see what's going on. And what we're saying is we are sounding the siren right now. We're sounding the warning, and we need everybody to take heed of that warning, because we're doing what we can within our power to get that warning out. So I just ask everyone, when the analogy came forward, it's something that really reminded me, and something that is a visual that I wish we could get everyone to take the action they need to, certainly, but we're sounding that siren, and I can't think of anything else to call it that it is, but this advisory is a warning siren. So thank you for letting me continue. There's a lot to say about this topic. Now we do have with us on a different subject, presentations from staff. I guess we have Mr. Ross, and I know I'll say your last name wrong, so I'm going to let you introduce yourself, who's joining us to provide an update on the Rock Island Trail. So welcome, Ross.
Thank you. And the name is Ross Fanninsteel. So for those who read my name and still trying to figure it out, it is Fanninsteel. So thank you for that introduction. And thank you, Mayor Turgeon and all of the city council members for allowing us to present this project and what we're doing for the Rock Island Trail. And really, it's the Rock Island Trail State Park. The Rock Island Trail was a part of that. With me on the call, I have Bob Foster. He is the new executive director of the Missouri State Parks Foundation. I'm actually going to let him start out talking about this to give it a brief overview of where we're at, what's going on, and I'll talk a little more about the goals of the campaign and some other things at the end. But I want to introduce Bob, since he is definitely new to the Missouri State Parks Foundation. In terms of being the executive director, he's actually been a board member before. So Bob, I'll turn it over to you.
All right. Well, thank you very much, and thanks to the council for inviting us to speak for a few minutes. I trust that everyone is familiar with the Katy Trail and the council, and also familiar with the importance of outdoor recreation during the pandemic and how that's exploded as an opportunity for people to find at least one way to socially distance and to take advantage of time together in a safe way. We have an opportunity. The former Rock Island line is owned by Missouri Central Railroad, which is a subsidiary of Ameren. It became available for rail banking in 2014. 47 miles of this trail from Windsor to Pleasant Hill is complete. It was completed in 2016. A year ago, Ameren agreed to work with the Missouri State Parks to develop the 144 miles from Beaufort on the east side near Union, Missouri, connecting to Windsor in the west, where it would connect to the Katy Trail. As everyone knows, the state doesn't have unlimited funds, so they did place a requirement on the trail and on this project. Before they would accept it as a state park, they required that citizens and interested organizations raise $10 million toward the initial cost, security, signage, fencing, all of the things that would be needed as a first step toward building this trail. It sounds daunting. I'm not going to kid you, but Ameren has already spent $6 million to remove the rails from this trail, an important first step. The other thing that's important to realize about the trail is that there are 23 communities along it. It connects to the Katy Trail on the west end and is only about 15 miles away from the Katy Trail on the east end. In the middle, Jefferson City will be only 20 miles from the Katy Trail, from this Rock Island Trail. And also, it's on the doorsteps of the Lake of the Ozarks, one of our big state destinations. So all of these pieces are in place. We have support from the very beginning of the communities along the trail. They started the initial Rock Island interest group. Our project is to raise funds in the next year to get us to that $10 million mark. And Ross and his organization are key to making that happen. So again, thank you very much for your time. Ross?
Thank you, Bob. Yeah, this is really a once in a lifetime opportunity to really benefit Missouri and visitors from around the area and the region for years to come. The economic development for the 23 towns across Missouri that are directly along the trail, they expect to see an economic development similar to what we've experienced with the Katy Trail, which draws in roughly 400,000 visitors annually a year, and about $18.5 million in terms of economic impact. So those are really powerful things in terms of the towns along the trail, for them to bring in tourism, bring in visitors, and really to link all of those basically from Kansas City to St. Louis all along that trail. And when you combine these two trails, the Katy Trail and the Rock Island, it's a combined 441 miles back and forth across the state, which is by far the longest in the nation, and something that we've received some interest from nationally in terms of that recognition, and maybe ways to be able to utilize the trail because of that. So definitely some interesting opportunities out there. The total goal of this campaign is $15.7 million. That includes the $5.9 million gift from Ameren, which is the gift of land. Again, they're ready to donate that upon receipt of the other $10 million that we need to raise for the initial security and operations and some things for the first several years. So this way we can actually start developing the trail. We've been meeting with some of the towns along the way to present some of the concepts, but also to let them know that this needs to be something that is really embraced by everybody along the trail. 41% of the population of the state of Missouri lives within 50 miles of this trail. And so it's pretty significant when you think about the access that everybody has to this. And so we want each of the communities to also be involved in helping us with trying to reach out and figure out who we should be approaching, who are the major gift prospects, other people that we should be looking at to really get engaged in this. So as we move forward, again, we need roughly 9.8 million left by the end of 2021 to secure the trail. We've really just started in the fundraising aspect. We've got about $200,000 raised. We currently have almost $3 million out in proposals that we have met with some lead gift prospects and some people that we feel very strongly are going to support this. So we have a very good start. I think one of the biggest benefits of this is that of the team that's working on this is that it's a very diverse team. We have representatives from Kansas City, St. Louis, Jefferson City, Columbia, Springfield, Lake of the Ozarks, really all over the state being involved as part of this campaign leadership team. So we really take pride in that, and they're reaching out in their areas and really trying to draw in that support. So that's where we're at. Just wanted to update everybody on where we were in terms of the scope of the project, what the goal is, and how we plan on moving forward. So with that, I'll just open it up to if there's any questions for either Bob or I.
Thank you for that presentation. It's exciting to hear the update. I know that being to the Katy Trail, we realize what an asset that is, and the timing too. We've realized with the pandemic just how much people utilize that trail, and biking has seen such a great increase in walking and biking and the importance of getting outside. And so this is a very exciting project, and we are pleased that the city of Jefferson can be connected with this and informed, and we'll put it out there to the community if anybody wants to give to this project to let you know, and at least they'll know now kind of the latest on what's going on. Does council have any questions or any comments, anything to add to this?
I just had a question, Mayor.
Yes.
And I don't know to either one of you, and I didn't really track it. What has been the response of the legislature? I know it's got some discussion under the dome. It's really not on my list of issues to watch, so I didn't really track it. But what's been the response as far as the legislature and maybe their interest in supporting the project?
Right. So the agreement with the state and the support that we've received is that everybody certainly understands the benefits of wanting to move forward with this project, especially in terms of the economic development and the public benefit, just health-wise for the communities. But as Bob alluded to, the issue is just the initial dollars to get it started. And so the agreement is that if those initial dollars can be raised, that then the state, the Department of Natural Resources, DNR, would then oversee the development of this project. And of course, we would help with the fundraising of that as well. But then it would fall within the scope of all of their other state parks for support. So it is something they're very excited about. They want to support it, but it's just getting through that initial stage to make it happen. So this first phase is all about securing the land and getting the dollars in place to be able to support the operations. And then this next phase will be the actual development of it to make it usable. And in addition, it's not just falling on Missouri State Parks Foundation for the development. Each of the towns along the trail is really taking some responsibility for developing their section of it. So it really is a buy-in of everybody along the way to help make this possible. We've been blessed to have Mike Sutherland from Missouri State Parks very involved with this, and he's been very supportive of this and is really doing all he can to make sure we've got support from the state to be able to move forward with our campaign.
Well, that's great news, and whatever we can do here on our end to continue to get the word out, I think it's so. We appreciate you giving us this update, and we'll look forward to more sending us more information. We could certainly distribute that through email to the council or whatever you have. Feel free to share it with us. Any other questions?
Yeah, we'll definitely do that. I will send Mayor Turgeon, I'll send you some of the collateral we have in terms of the case statement and the economic development infographics. So you have that information and can pass it on to the city council if they'd like to see that. And, if anybody has any questions, you could always reach out to either Bob or I. It's just very interesting in terms of as people try to find an outlet right now. If you've been out on any city, state, or national park and just seen how in demand they are right now because of people looking for that outlet from being home and being in their small circle of influence all the time, the demand is just amazing right now. So we want to be able to help relieve some of that and provide another outlet.
That's great. And it's really just outside our back door of Jefferson City, really. So this is something important for us. So thank you both for being here. We appreciate the update. So we'll look forward to more information. Thank you.
Thank you.
All right. Item 8 is announcements by mayor, council, and staff. And our committee meetings are listed at jeffersoncitymo.gov on our meeting calendar. All of our meetings are meeting virtually now. So I'll run down the 4 standing committees to see if there's any announcements, starting with Administration Committee, Councilwoman Wiseman.
At this time, we did not have an administrative meeting administration meeting this month, but next month we'll be looking at that, and it will be virtual if we do have one.
Thank you. The next one is Finance, Councilman Hensley.
Thank you. The Finance Committee had a meeting scheduled for this coming Thursday, but this meeting has been canceled.
Okay, thank you. Public Safety, Councilman Graham.
Yes, our normal regular scheduled meeting was scheduled for the 26th. And as we all know, the 26th is Thanksgiving. So we will have our meeting on tomorrow morning at 7:30. And like Madam Mayor said, it will be virtual. We do have 3 items we'll be discussing tomorrow morning with public safety. And that is radios, cameras, and we'll also have a presentation from the Fraternal Order of Police. Detective Bowman, the president, will be presenting to the committee as well. So those are the items for tomorrow morning at 7:30.
Thank you. And Public Works and Planning, Councilman Hussey.
Thank you, Mayor. We met last week virtually, and our next scheduled meeting is December 10th, and that one will be virtual again as well.
Thank you. And I'll remind the public that although they're virtual, there is the same level of participation like in our council meeting through the WebEx format that people can either phone in or be part of the video as well. So complete openness and public participation, and we certainly encourage that. Item B, the Missouri 2020 Bicentennial Update. Today was the dedication of the Tri-County Bicentennial Monument. It celebrated 200 years for Cole, Callaway, and Boone County. And if you haven't had a chance to see that, that is out at the Katy Trailhead, just right across the river. And Central Bank sponsored that monument. It's a nice tribute to our history, and that was dedicated today in a nice outdoor ceremony. So would certainly encourage everyone to take a look at that. And then last weekend, they had a dedication at the Cole County Courthouse, where they also had a bicentennial monument for 200 years of Cole County. At today's bicentennial celebration for that monument. They turned over the Cole County Bicentennial basically from the county to the state, because we know Cole County turned 200 before the state of Missouri did. So now they turned that over. Commissioner Bushman turned it over to Governor Parson as we move forward in 2021 with the state of Missouri's bicentennial. So again, if you're not already following Missouri 2021 on Facebook, Twitter, and Instagram, be sure to do so. I have a couple of other announcements. I have been giving out a few proclamations, mainly either virtually or just one-on-one. So we did have a proclamation for Cosmopolitan International Day, and that was done because of all of their work with diabetes. So National Diabetes Awareness Month is the month of November. So please take a moment to highlight that organization and all they do for diabetes awareness.
Yeah.
And I think I might have a conversation going on in the background there a little bit. But I did also want to announce that I also did a proclamation today for Adoption Awareness Month. And that is something that's important to keep at the forefront, that those people who are involved in and needing adoption in our community. And then I'll direct your attention to the screen. We do have Jennifer Sakanik, who is our assistant in the front office, and Jennifer designed and painted this United Way hat. And I know we've seen these hats all around town, but I wanted to recognize her tonight because this hat won the most creative hat. And very impressive. If you get a chance to look at that up close, you can see all the different landmarks and areas in Jefferson City. It's a Dr. Seuss theme about, the places you'll go. So it shows going through all the places in Jefferson City. And if you really focus in, you can see Capitol Avenue, City Hall, Police and Fire, and all the departments, and then United Way, and then J.C. Strong. And there's even the mayor doing a selfie right in the middle there. So, but it was really nice. I know Jennifer has always gone above and beyond. She serves on part of the United Way board and committee, very committed to that organization. And anytime there's these other duties as assigned that require creativity and artwork, she always comes through. And I thought it was really cool that this one most creative. So giving a thank you to Jennifer there, and appreciate her work on that. Are there any council announcements this evening? Okay. Item 9, Lincoln University Student Representative Update. I will turn it over to Carlos to give us the good news that we have a new student member. Councilman Graham.
Yes, Mayor, and to the council members, we do have a new City Council Liaison representative. His name is Stacy Landis. He is from Kansas City, Missouri. Unfortunately, he cannot be on tonight, but he will join us virtual at the next council meeting. So this is the last week for in-seat class. The students will be off next week for Thanksgiving break, and then they will resume remotely the week after that for the last 2 weeks, so that our students will be leaving on Friday of this week and will not return until January of next year. So.
Thank you for that update, Councilman Graham. And we are very excited to welcome Stacy Landis to our council as our liaison. And we really enjoy having that connection directly with Lincoln University. So really looking forward to that. Item 10, presentations from the gallery on specific bills or resolutions. Is there anyone, Mrs. Donaldson, who signed up, or anyone on the line?
No one signed up.
Okay, do we have anyone on the line to speak about a specific bill or resolution this evening? Hearing none, item 11, consider a motion to approve.
So moved.
So moved. Second.
Any further discussion? All in favor say aye.
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 Any opposed? Motion passes. Item 12, bills introduced 2020-45.
An ordinance of the City of Jefferson, Missouri establishing election dates in the City of Jefferson, Missouri for the 2021 general municipal election.
Mr. Molden.
Thank you. This ordinance establishes the election date and candidate filing times for the April 6th, 2021 general municipal election. Candidate filing opens up on Tuesday, December 15th, and closes at 5 o'clock on Tuesday, January 19th of 2021. So this is in preparation for the April general municipal election.
Thank you. Any questions or comments? All right, Bill 2020-46.
An ordinance of the city of Jefferson, Missouri, vacating and discontinuing a portion of an unnamed right-of-way in the northwest quarter of the northeast quarter of section 23, township 23 north, range 12 west.
Mr. Marash.
Thank you. As Clark indicated, this is vacated a section of right-of-way. It's a old county road right-of-way on Beath Drive that basically goes through the Water District number 2 property. And in combining their lot, they seek to vacate this. That way they'll allow them to construct a new building on that site. Happy to answer any questions.
Thank you. Any questions or comments? All right, item 13, bills pending 2020-42.
An ordinance of the city of Jefferson, Missouri, authorizing the mayor and city clerk to execute a $50,905 agreement with SGI for the HVAC upgrade at 2320 Hyde Park Road project.
Mr. Marash.
Thank you. As Clark indicated, a construction contract. It'll upgrade our HVAC at the wastewater facility on Hyde Park facility, at the Hyde Park facility, excuse me. And that system was built with the original building over 20 years ago now, and is in need of replacement. This will replace that system.
Thank you, Mr. Marash. Any questions? Deliberation? Roll call, please.
Fitzwater.
Aye.
Graham.
Aye.
Hensley.
Aye.
Hussey.
Aye.
Kimna.
Aye.
Lester.
Aye.
Schreiber.
Aye.
Vogt.
Aye.
Ward.
Aye.
Wiseman.
Aye.
Bill passes. 2020-43.
An ordinance of the city of Jefferson, Missouri, accepting and approving the final subdivision plat of a replat of Lot 1 of Capitol Mall subdivision, a subdivision of the city of Jefferson, Missouri.
Mr. Sanders.
Thank you, Madam Mayor. As the clerk indicated, this is a final approval and acceptance of a subdivision plat for the Capitol Mall subdivision. It's actually a replat. The Capitol Mall has been around since the 1970s, and something not necessarily unique to the mall, but interesting is that 2 parcels, the J.C. Penney building, which is part of the Capitol Mall building, and the Dillard's building are on their own parcels. This subdivision replat basically will take the footprint of the old Sears building and subdivide it out into its own parcel. This is not uncommon on these types of arrangements. What is interesting, though, is the Sears wing, the former Sears wing, it's required to actually have street frontage. So the property owner has already sought and was given a variance to the zoning code, which requires this by the Board of Adjustment. There's a second section of code that requires street frontage, and that is the subdivision code. Part of this ordinance actually provides a variance for that. Now, this is possible because the Capitol Mall and the owners of the parcels within the subdivision have certain operating agreements which address how they are going to provide for access for infrastructure, for vehicles, parking, basically anything you can imagine in allowing those property owners to function appropriately. And this has been through the Planning and Zoning Commission. They're forwarding it to you with an approval for recommendation. There is no fiscal impact other than a Planning and Zoning fee of $200. And with that, I'd be glad to answer any questions.
Thank you, Mr. Sanders. Any questions, comments, roll call, please.
Graham.
Aye.
Hensley.
Aye.
Hussey.
Aye.
Kimna.
Aye.
Lester.
Aye.
Schreiber.
Aye.
Vogt.
Aye.
Ward.
Aye.
Wiseman.
Aye.
Fitzwater.
Aye.
Bill passes. Nothing on the 15 resolutions RS 2020-20.
A resolution of the City Council of the City of Jefferson, Missouri, authorizing application for a National Register nomination project through the Historic Preservation Fund grant.
Mr. Sanders.
Thank you, Madam Mayor. This resolution allows the city to apply for a grant from the Historic Preservation Foundation for a consultant to help us prepare a nomination for 2 subdivisions out off West Main to be placed on the National Register of Historic Places. These 2 subdivisions were surveyed last year through a similar grant, and they are the Walenko and General Realty subdivisions, basically along West Main between the 1600 and 1700 block. North, it includes Lavinia Park, Lavinia Street, and several of the Circle Drive roads. The benefit of this is for property owners that have structures and buildings which contribute to the nomination to the registry. Those properties would be eligible for federal tax credits for improvements, which would help them maintain and invest in their property. The application is due in December. We probably would not be notified if we were selected as a winner until August or September. So that brings us to the fiscal impact, which the grant would be about $9,000. Our match would be 40%, which would be $6,000. Not necessarily knowing the date of when we would receive the grant. It's possible this could be an item that actually comes out of the 2022 budget. If not, if we get it earlier, we would ask for a supplemental appropriation to provide the match. This was reviewed by the Historic Preservation Commission. They helped us select what project to apply for. As a side note, we've been very successful on these Historic Preservation Foundation grants. We've got 2 going this year, and we've had several over the last several years helping us move forward. This activity is an implementation strategy identified in the adopted Historic Preservation Plan. And with that, I'd be glad to answer any questions.
Thank you, Mr. Sanders. Any questions or a motion to approve this resolution?
So moved.
Second.
Any further discussion? Roll call, please.
Hensley,
Aye.
Hussey,
Aye.
Kimna,
Aye.
Lester,
Aye.
Schreiber,
Aye.
Vogt,
Aye.
Ward,
Aye.
Wiseman,
Aye.
Fitzwater,
Aye.
Graham.
Aye.
Resolution passes. Item 16, presentations from the topic. Is there anyone on the line that would like to speak on any other topic this evening? Okay, seeing none, we will go on to item 17. Is there any council and staff discussion of presentation topics? I will just reiterate what Dr. Adams said, and I will also reiterate our city and county advisory that council endorsed this evening. We have sounded the warning siren. I need everyone to call to action. Stay home if you're sick, physical distance, avoid gatherings, wear your mask, encourage telecommunicating, and low to no contact shopping and eating out. Okay. Again, everyone, thank you. And item 18, any new business? 19, any unfinished business? Item 20, motion to adjourn. Okay. All in favor say aye.
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 Everyone have a good Thanksgiving and please stay safe and avoid gatherings. Thank you. Good night.